Before I explain the types of diagnostic tests, I would like to start with why these tests are needed in diagnosing epilepsy in children. Epilepsy is a condition that causes repeated seizures due to abnormal electrical activity in the brain, because many other conditions can also cause seizure, like infection, metabolic problem, or structural brain abnormalities. So the diagnostic tests are very important to find out the exact cause and type of seizure. The tests have the data to decide the best treatment and management for each child. Now let's look at the main diagnostic test we use in epilepsy. First, electroencephalogram or EEG is to detect abnormal electrical activity in the brain and also to determine the types of the seizure. Is one of the most important tools to confirm the diagnosis of epilepsy. And we have second laboratory tests. We have several lab tests are done to find out the possible causes or conditions that are related to epilepsy. The first white blood cell count have point out if there's infection. Blood glucose level is checked to see if the epilepsy were caused by the low blood sugar level or hypoglycemia, serum electrolyte, urea nitrogen, calcium, amino acid, lactate, ammonia, and uric organic acid have identified metabolic disturbance that can trigger epilepsy. Toxicology screening is to use to check for poisoning or exposure to harmful substances that related to seizure. If the epilepsy is related to genetic cause, we have to detect the chromosomal analysis. And the last, we have cerebrospinal fluid analysis is to confirm or rule out meningitis, which can also cause seizures. And the third main diagnostic test, we have neuroimaging. Imaging tests allow the medical person to see the brain structure, like MRI have to detect cortical malformations, tumor, scarring, or cortical dysplasia. Like MRI, CT scan is used to identify cerebral hemorrhage, infection, tumor, or gross malformity. So overall, the tests work together to determine the cause, type, and severity of epilepsy in children, helping the medical person to plan the most effective treatment. After confirming the diagnosis of epilepsy in child, the next important step in medical management. The main goal of the management is to control seizures, prevent complications, and have the child live as normally as possible. In this state, the nurse play an important role in monitoring the child condition, administering medication correctly, providing family education, and supporting adherence to treatment. There are four main approaches to medical management. The first is anti-epileptic drug therapy. These drugs help to stabilize brain activity and prevent abnormal electrical discharge that cause seizure. Medication like carbamazepine, feroxyl acid, phenytoin, and phenobarbital medication is to treat epilepsy and seizure. The second is the ketogenic diet, which is high in fat, low in carbohydrates, and has adequate protein. This diet shifts the body from using glucose to using fat as the main energy source, creating a state we call ketosis that have the reduced seizure frequency. The third is surgical therapy. This option is used for children whose seizure cannot control by medication, especially when they cause focal cortical dysplasia or mesial temporal sclerosis. Although surgery can be very effective, but it doesn't always remove the need of medication. The last one is vagus nerve stimulation or VNS. This treatment is for patients aged 12 years and older patients with drug-resistant pressure seizure. issue an implanted device that sends electrical impulses to the nerve vagus to reduce the frequency of seizure. In summary, medical management aims to reduce seizure activity and improve the quality of life. The nurse have a vital role in ensuring the child's safety, observing treatment effect, and supporting both the child and family throughout their management process.